Hello, my name is Dr. Julio Martinez-Silvastrini. I am the Medical Director of Baystate Rehabilitation Care, and I'm board certified in sports medicine. Today, we will talk about signs, symptoms, and treatment of sports injuries, as well as how to prevent them. Our objective for today will be to define signs and symptoms of injury and discuss quick guidelines of injury identification and management. Signs are things that we can see in our body that can mean injury. They may include redness, bruising, swelling, decreased range of movement or range of motion, weakness, and decreased sensation. Symptoms are things that we feel. For example, you may feel weakness, you may feel numbness, pain, or you may feel that the joint feels loose or unstable. Those are symptoms, things that you feel. Now, most of the injuries that we see are acute injuries, but overuse injuries are usually related to intrinsic risk factors, which may include someone that is predisposed to injury, or someone that is susceptible for injury because they have extrinsic risk factors. So what are those? Intrinsic risk factors are part of yourself, are part of your body, and they may include weakness, as muscle imbalances, lack of endurance, lack of flexibility, or previous injuries. Extrinsic risk factors are related to things that come from the outside and maybe the way that we participate in sports. That may include our technique, the surface in which we train, equipment that may be worn out or maybe even loose laces may put you at risk of injuries, and what we talk about or know about terrible twos. Terrible twos is what we discussed. There may be too much, too fast, or too soon, too many. So if you start training way too fast, you start doing too many repetitions, you start lifting too much weight, you start running way too fast without adequate preparation, that can put you at risk of injury. Direct trauma or macro trauma is a very common injury in sports. It's seen about 80% of hockey injuries. And for example, you can see a contusion that will be a helmet to the thigh or a blunt injury. Another type of injury that you can see will be laceration that may be caught by an elbow to the face. Microtrauma, on the other hand, is what we were discussing earlier, which are overuse injuries. These injuries may be, for example, a muscle stretch or a hamstring pull or a muscle strain. Now, muscle injuries may also be caused by problems with strength. So if we are weak, if we are too tight or inflexible, or we have issues with balance. It's not uncommon that if you have a previous ankle injury, you actually may have balance issues. These issues can put you at risk of having another injury. For example, if you injured your ankle in the past and you had bad balance or the muscles are tight around the injury site, that may put you at risk of having another ankle injury. Or you may have another injury above or below the joint. For example, if you have an ankle injury, you may injure your knee in the future. You may injure your back. So that is important for us to try to avoid injuries. Ligament injuries occur when you stretch a ligament to the maximum and then it starts ripping. The ligament connects a bone to another bone. And the ligament has nerves inside that will give you sensation how stretched the tendon or the ligament, I should say, the ligament is, which means proprioception. Injuries to the ligament usually occur, as I said, when you stretch the ligament to the maximum and then you start pulling together the muscle fibers or you can tear them. Tendon injuries occur when you stretch the tendon, and different from a ligament that connects the bone to the bone, the tendon connects the muscle to the bone. The tendon can get injured if you stretch the tendon too fast or you provide a lot of strength or tension to that tendon. Once we have an injury, there are a series of things that will happen in the process of you recovering. The first thing that we'll see is after an injury, inflammation. That will happen for the first 48 to 72 hours, and you'll see a lot of swelling, a lot of redness, some of these signs and symptoms that we discussed earlier in the presentation. After the inflammatory phase passes, then the tissue will start healing, but it's almost like a scab. It's a muscle or tendon or ligament that is very, very, very weak. After that, that scar will build up, will get stronger, will get more sturdy. And that's what we call the maturation and remodeling phase. And this process of recovery, of healing, can be promoted or improved with adequate rehabilitation. For example, in the first phase of treatment, what we call the phase one, we will like to first of all have a good diagnosis, and we will use what we call the PRICE principle. PRICE is an abbreviation for protection, which is basically wavering as tolerated. Sometimes we may need to give athletes crutches or braces to try to protect their joint. The R stands for relative rest. Patient will rest the injured side. For example, if you have an ankle injury, you may be able to continue doing exercises for your abs and the exercises for your arms. Or you injure your shoulder, you can keep running or doing ab work. So there's just rest the area that is injured. Ice is usually used in the process of inflammation to try to decrease pain, to decrease swelling. We don't recommend icing for longer than 20 or 30 minutes. And you can ice every 2 or 3 hours, but we don't recommend to ice more than 20 or 30 minutes, and we don't recommend to ice more often than every 2 hours because you can use a frostbite. You can cause a frostbite. We use compressive devices like ACE wrap or athletic sleeves to try to decrease swelling, and elevating the limb above your heart level may help to decrease any swelling as well. It's important to not rest too much, and that's where that concept of relative rest comes into play. If we rest too much, that will cause a lot of weakness. For example, we know that if we use a cast, you can lose about 5% of your muscle in one day, and you can lose up to 10 to 20% of your strength in 2 weeks. So it's important for us to keep moving. It's important for us to keep doing exercises. Bed rest also can decrease your ability for you to be running or doing activities for a long time. You can lose up to 50% of your aerobic capacity if you are resting in bed for a month. And that's where that relative rest concept comes into play. It's important, as I said earlier, to rest the joint that is affected, use the other limbs that are not affected. And for example, if you have a shoulder injury on one side, strengthening the other shoulder may help to keep the strength. And you can keep up to 20% of strength compared if you don't do anything with the other side. In the phase two or reparative phase, as we are creating this new scar tissue, we start working on early rehabilitation. So we want to do controlled range of movement. We want to slowly and progressively improve your ability to put weight in the limb. We want to keep that aerobic capacity going, and we can start doing some strengthening exercises. On the third phase, what we call remodeling phase, that tissue will start healing. And it's important for us to retrain that tissue again to avoid re-injury. How we do this? We need to improve strength. We need to improve the range of motion. We need to improve our balance. How we do improve the range of motion? We need to do strengthening and stretching exercises. For balance, we need to do exercises of balance. And of course, we will start doing exercises to simulating our sport to try to heal and improve faster. This is a model that I like to use as part of our fitness model. We have 3 areas. On the top, we have aerobic capacity. On one side, we have flexibility, and the other one, we have strength. And if you have deficit on 1 or 2 of these areas, that can cause injury. For example, if you may be strong, but you get tired very fast, so you don't have good endurance or good aerobic capacity, you may be at risk of injury. Or you can run for 2 or 3 hours without getting tired, and you're very strong, but you are super tight. That tightness might end up causing injury. So it's important to keep in mind that we need all these three elements to be fit. Exercises that we can do to improve our strength, for example, resistance exercises, will help us to build muscle. And those exercises are recommended to be done 2 or 3 times a week. For example, if I do an exercise for my biceps, I need to give that muscle at least one day for it to rest, for it to heal. And then, for example, if I exercise on a Monday, when I take Tuesday off from working on my bicep, and then maybe Wednesday or Thursday, I can start working on my biceps again. Otherwise, the muscle can get injured. What kind of tools can we use to build muscle? We can use weights, we can use elastic bands, and even exercises in a pool, like what we call aquatic exercises, may help. Now, to build up our aerobic capacity, it's important for us to do exercises that last for a long time, usually longer than 15 minutes. That may include jogging, cycling, swimming, dancing, or using devices like an elliptical trainer, a treadmill, or a stepper. What we want to use is start helping our body to use oxygen more efficiently. And that is the component of our aerobic fitness. Lastly, to improve flexibility, we want to do stretching exercises. Dynamic stretching is very, very good, but if you select to do static stretches, we recommend that you stretch between 3 to 5 times and within 15 to 30 seconds. Now, if you stretch, you get a long stretch of 2 minutes, that only counts as one set. So the reality, you're wasting a lot of time doing stretches of 1 or 2 minutes. You will be better served doing few stretches of 15 or 30 seconds, and that will be more efficient than doing a one long stretch for a minute or two. Now, which elements do we need for someone to be able to return to play sports safely? Number one, they should be able to move their limb without difficulty. For example, if I have a shoulder injury and I cannot lift my shoulder without pain, I may end up causing a neck injury because I'm starting using other muscles that are not designed to help me move my shoulder. So if I have a shoulder injury, I should be able to move my shoulder freely without pain. I should have the same strength on both sides, and I should be able to do everything that I need to do for my sport. In that case, if I have a shoulder injury, I should be able to throw without pain. Other thing that you should be able to do without pain, you should be able to run, to cut, to pivot, and to jump without pain. That will be more for anyone that have an injury on their leg. In summary, we discussed signs and symptoms of injury. We also discussed intrinsic and extrinsic risk factors, like, for example, lack of flexibility or strength can put you at risk of having injury, or what we discussed the terrible twos, progressing way too fast in your training, too fast, too much, or too soon. And we also discussed that it's important for us to have elements for fitness, which include strength, aerobic capacity, and flexibility. We discussed that injuries can involve the muscle, the tendon, or the ligament. It can also be caused by an acute injury or may be caused by overuse, which is the most common type of injury. We also discussed the process of healing and recovering from an injury. I thank you for your attention and have a great day.